When you click on the Thrombo Sensor, you come to this section, and this is all about thrombosis. And thrombosis is a quite common disease. It is the development of a blood clot within the bloodstream, so where the blood is not supposed to clot. And when this happens, the blood clot can be flushed along the blood vessels, and it can then be jammed somewhere, and it can disrupt the blood supply to certain tissues. If this happens in the brain, we usually speak of a stroke, so parts of the brain are starved of oxygen and can then die off. If this happens in the heart, it can be a heart attack, and if it happens in the lung, it is often most severe. It's called a lung embolism, where the lung cannot be supplied with oxygen, the body does not get oxygen, and this can very quickly lead to death. So thrombosis is a common disorder. It is more common in older people, but it can also affect younger people. So in this section you will find general information about thrombosis, as well as information of how common it is and so on. This is particularly important for women, especially the ones that take hormonal contraceptives or hormone replacement therapy. If a hormone preparation is used, this already naturally increases the risk of thrombosis. It's usually in the range of twofold, which is still okay. But if a unidentified genetic variation comes to it and also increases the risk of thrombosis, these two risks are multiplied together. So the risk can be anywhere from 16 times higher to 200 times higher than in people without the genetic risk and without hormonal preparations. So in cases of genetic risk, it is important to talk to your doctor about it, to make sure that either an alternative contraceptive is recommended, or also blood thinning strategies are started together with the hormonal preparation. So do read through this in case you're interested in it. If you want to know about your own personal results, you have to click on Summary of Effects. Now in this example, this person has a normal risk, a very low risk of developing thrombosis. Do check your own results, they might be different. But in this case, the summary says your risk of developing venous thrombosis is not increased and arterial thrombosis is also not increased. Now, these are two different types of thrombosis depending on where they occur. The venous thrombosis happens in the veins. So it happens in the blood vessels that go back towards the heart. Now there are frequent valves in the veins that prevents the blood from flowing back. So it's usually in the legs. And around these valves there's a higher risk of thrombosis to develop, especially when certain genetic variations are present. Arterial thrombosis, on the other hand, happens in the blood vessels that move away from the heart. And these are two different things, two different mechanisms, and different genetic variations can individually increase the risk of one and not the other. Also, hormonal preparations only interfere with the risk of venous thrombosis and not with arterial thrombosis. So this also needs to be considered. So in this case, the risk of developing thrombosis in total is normal. If your arrow is here, it means that it's very important for you to take prevention. The risk of venous thrombosis here is normal, and arterial thrombosis is normal. So this up here is just a summary of the two lower bars. So do check your own results to see what your personal risk is. And finally, the prevention. Now this is also likely going to be different for you depending on your genetic results. So do check your own results. In this case, this person has no risk of thrombosis, so it should only do normal recommendations for thrombosis prevention, such as getting up during long sitting periods to prevent the development of thrombosis in the legs during long flights, for example. And generally these kind of recommendations are sufficient. No medical treatment in these cases is recommended. So do check this to find out if there is any different recommendation for you, and if you should talk to your doctor about your risk of thrombosis, to maybe change your medication regime or maybe use a different source of contraceptive.